Desert Healthcare District and Foundation presents a podcast that supports your health and wellness where you live. This is Healthy Desert, Healthy You, hosted by Will Dean. Now, here's Will.
Hello, friends. I am excited because I am here today with the CEO of the Desert Healthcare District and Foundation, Chris Christensen. Welcome, Chris.
Thank you. Glad to be here.
One of the reasons why I wanted to have you on, other than you being the big boss, is that I wanted to talk a little bit about the Healthcare District and Foundation because as I've been out in the community, I realize that we have a lot of support and we have a lot of people who know who we are. But there are a lot of people who don't know the district and what the district does and what the foundation does. Could you talk a little bit about our history and what we do?
Sure. Thank you. I appreciate that opportunity. So the healthcare district was founded in 1948. It was defined as a hospital to help serve the community during the wartime or post-war time. And so a hospital was developed at that point initially and has grown over the years. And the district in 1997 was operating the hospital until that point, and then was a lease that was established with Tenet Health Systems to operate that hospital on a 30-year lease. And so we have continued at that point with our district funds and doing a very robust grant funding program. And along with our foundation that was established in 1967, we continue to do healthcare funding with nonprofit organizations and continue to work with community partners at all healthcare related opportunities. And so we primarily work with the nonprofits and work with the organizations, as I've said, that provide access to healthcare. In 2018, our district expanded our boundaries. Used to be just west of Cook Street. Now the expansion takes us to beyond Cook Street all the way out to the Salton Sea, Thermal, Mecca areas. And in addition to that, we added 2 additional directors to our board. And so we now have 7 elected board members that serve for the healthcare district. And their constituents typically are around 60,000 residents in each of the districts or zones that they represent.
All right, so that's a really good summary of our history. I want to emphasize the point. We are not a hospital. We do not run a hospital, right?
That's correct. That's correct. No, that's a key point, Will. So, and that is an extremely important point because a lot of people do misinterpret that or misunderstand that the Desert Healthcare District is not Desert Regional Medical Center. And so with the lease establishes that Tenet Health Systems, who operates the hospital, they're strictly the operators. And Desert Healthcare District is a funder in the community to help support healthcare. So there's that key distinction there that we do not operate the hospital, and that's kind of the misperception there.
You mentioned that we are a funder in the community. I'm very proud of the district. We have actually awarded more than $100 million since the whole grant-making part of the district began. So that's pretty exciting.
Absolutely. Yes, and that goes back to 1997 when we became more of a funding organization to assist healthcare in our communities. And you're absolutely right, over $100 million of grant funding in that period. We are very proud of that.
I want to talk about some of the achievements that the district has made during that time. We've done some pretty remarkable things, if I do say so myself.
Absolutely we have. So, some of the items that we can talk about or that we think about has to do with going back to the Clinton era initiative to provide insurance coverage to our residents. I mean, there were many residents that did not have insurance, And so there was a Covered California enrollment process that we were very actively involved with to be able to get residents medically insured. Then another big one was in 2020 when we experienced, unfortunately, our COVID-19 pandemic, and the response that the healthcare district was involved with, that we worked with the county and Riverside University Health Systems and Public Health Institute to provide funding resources in our community. And so we put together a collaborative of several nonprofit organizations that have worked together to initially provide education to the community as well as testing. And we've had many testing events early on in that cycle. And then once the vaccination came available, then we've hosted many, many events to be able to vaccinate our residents and to help provide, protection to our workers and our community.
So many of these things all of these things are really about advancing health and wellness. And I want to share with our listeners that the district's mission is to optimize health at all stages of life for all district residents. That means all residents of the Coachella Valley. Something recently that we've started a program that's about advancing access to healthcare is our mobile clinics. Do you want to talk a little bit about that?
Absolutely. Another item that we're very proud of, project that was started about 3 years ago, and we initially started with one mobile medical unit, and it's been operated by Desert Physicians Medical Group, and we've since added a second clinic that also provides access to care in our communities. So the first unit typically provides on-site kinds of exams or appointments for people that are unable to seek transportation or have limitations to getting to a clinic or a service provider. And so we're able to take those clinics directly to the locations where these people exist and provide healthcare services to them. Even with our second unit, we have the ability to issue prescription medications and provide those medications to them right at that time. And we also provide mental health type services with telehealth or in-person visits. And during that process, we also try to establish a medical home for those residents so that they do have a place to continue their healthcare needs.
And that's primarily through referrals. They're actually referred to a brick and mortar clinic or hospital.
That is correct.
And what I like to say about the mobile medical clinics is that we are bringing care services to where you live, work, or play. I've been out there. I've seen the mobile clinics in the farm fields of the Eastern Valley, in church parking lots, in school parking lots. It's really an incredible thing to see.
Yeah, and to that point as well, we're doing at this point quarterly and sometimes more frequently some health fairs and health locations that are specific to, say, women's health as well, with regard to we have a mobile unit that works with us that provides mammograms to the women in our community to help identify if there's cancer concerns, etc. So, there's partnerships that we have established with these medical units as well, with DAP Health and Borrego Health with their mobile units. And we anticipate that we will develop more of that along the way.
That's really important. I want to talk about something that I know you're excited about, and I'm excited about. It's the environmental health work that we're doing. We started with a summit in 2024. Would you talk a little bit about that?
No, it was our inaugural environmental health summit that engaged with community partners, with different organizations, and the community in general, where we held information sessions that experts spoke at, and we had different topics all related to environmental health, typically air and water quality. And it was spurred on by the tropical storm Hillary that we experienced in 2023 and the uptick in the air quality issues that we experienced as a result. And so it was important to our board of directors and staff to be able to address the environmental health issues that we have in our community because it's so overwhelming. And we did have over 300 people attend that first summit, and we are in the process of planning our second summit, currently being planned and developed for September 11th and 12th of 2025. And we're really looking forward to that event to continue the work that started with the first one. And that's part of the purpose of these podcasts is to continue the communication between the two summits. And we want to ensure that folks have that date on their calendar. Again, that's September 11th and 12th, 2025. And you can also go to Healthy Desert, healthyu.com. And again, that's Healthy Desert, healthyu.com.
I want to talk a little bit about the future for the district, what we know so far. In November of 2024, there was a ballot measure that changes that a bit. If you want to talk about Measure AA and what that means for the healthcare district.
Absolutely. It's a very exciting component of the healthcare district's history as we've gone through several years of negotiations with Tenet Health Systems to extend the lease that currently expires in 2027. And so there was a very involved process. We included the public in that process. We held over 11 public meetings to gain feedback and communication from our community residents. And ultimately, that resulted in a lease purchase agreement that was negotiated and accepted by both sides. And as a public agency, we're required to put that on an election ballot to allow the residents of the district to vote either yay or nay for that initiative. And so that passed resoundingly with a positive vote of 72%. And so we're excited about that in the sense that we receive several $100 million over the next 30 plus years, and that will help continue the support of the health and wellness programs and access to care that the healthcare district provides.
Right. That's going to fund the mission that I mentioned earlier.
Absolutely.
Our mission. I want to say, please remember to subscribe to the podcast wherever you get your podcasts. I am Will Dean, your host, Director of Communications and Marketing for the Desert Healthcare District and Foundation. Again, I want to thank our CEO, Chris Christensen, for being on. Chris, thank you.
You're welcome. Thank you.
And of course, you can come back anytime.
All right, I'll be here.
Thank you for joining us on this episode of Healthy Desert, Healthy You. This podcast is a production of the Desert Healthcare District and Foundation in Palm Springs, California. For more information, please visit the website dhcd.org. Our annual conference site is healthydesert.healthyu.com. This podcast is available at most major podcast portals, including Amazon Music, Apple Podcasts, Audible, Captivate.fm, Spotify, and YouTube Music. Thanks for listening. Be sure to subscribe.